Welcome everyone. It's a very exciting night tonight. The inaugural Doctors for the Environment Australia and Australian Medical Association event looking at sustainability in the Australian healthcare sector, climate change and sustainability, leadership and action for Australian doctors. So thank you everyone for joining in tonight. Firstly, I'd just like to acknowledge the traditional custodians of the land on which we're meeting. I'm on Awabakal land tonight. We recognise that the First Nations people have cared for the country for millennia and seek to learn from Indigenous ways of knowing, being and doing. We acknowledge the sovereignty of this land was never ceded and pay our respects to the First Nations elders past and present and to the emerging leaders. So tonight's a bit of an action-packed evening. We have three presentations to start with, giving us background about the healthcare in Australia, where we're at with climate change, and what we're going to do about it. And we then have 13 colleges who are going to present what they've been doing, and come up to speed with where everybody is at present. Just to give some housekeeping, I'm sure most of you are familiar with Zoom now. We would appreciate questions through the evening, and you can post those in the Q&A. There's also the chat function, so feel free to keep a discussion going along the way. And we can try and look at that as we go as well. We are recording this webinar tonight, predominantly for the presentations. They won't be released publicly until we've had approval from everybody to do so. So we've got a tight time frame, so we'll get underway. We'll first start with Dr Eugenie Kayak. She's a Melbourne-based public and private anaesthetist who is the immediate past co-chair of Doctors for the Environment Australia. She's been working tirelessly for over a decade in this sector, trying to reduce the emissions from the anaesthetic specialty, but also advancing the activities of Doctors for the Environment to reduce the impact from climate on our health and the environment. So I'll move over to you, Eugenie, and you can take it away.
Great. Thank you, John. And thank you everyone for being here tonight. I must say, it's really welcome the opportunity to partnership with the AMA to bring so many together, to share information and enable further action on climate change and sustainability from us as a sector. DEA's vision, Healthy Planet, Healthy People, reflects health's absolute inextricable link to healthy, stable environments. As I think we're all probably aware, our environment at the moment is under incredible stress from many factors, but particularly global warming and how it impacts on our environment and our health. Human-induced global warming, the evidence for that is now unequivocal. And in our work and personal lives, we all bear responsibility for that. So tonight we're collectively coming together to share action and leadership tips about what we can do as medical professionals to address this and why climate change is so linked to health. Because climate care and healthcare are inextricably linked. The Lancet alarm raised the alarm over a decade ago that climate change was the biggest global health threat of the 21st century. And 15 years ago, DEA and the AMA co-produced this poster. I show you this tonight, even though it is 15 years old, to remind us that the last 15 years have really been squandered when it comes to action on climate change. We've failed to actually address what's happening and to protect the health of humans and the planet. Climate change is a true existential threat to the planet, and it threatens all our goals for development and social progress and health. We can't afford for the next 15 years to be squandered, because business as usual is not something that we want to really be left with. Business as usual would mean a child born today is likely to experience a world 4 degrees warmer. That would mean impacting their health from infancy to old age. So we have a choice. We have a choice personally and as a profession to act now and ensure our global temperatures are limited to 2 degrees or less. And by doing that, also reap the rewards of the co-benefits from climate change mitigation, such as cleaner air, healthier food and transport, and healthier energy choices. Energy choices being important, as highlighted in this perspective in the MJA last year. And particularly important in Australia, where our action on climate change is surely lacking. As they told us in this perspective, Australia, of all the OECD countries over the last 3 decades, is the only one to actually have a worsening carbon intensity of our energy supply. Which is why last year, Doctors for the Environment Australia and the AMA decided we needed to act, and we committed to work together on the anniversary of the Black Summer fires to call on the federal government to adopt a suite of key measures to help reduce the risk of further climate-related disasters, such as a national climate and health strategy, the reduction of Australia's greenhouse gas emissions aligned to science-based targets, working to reduce our own healthcare sector's emissions with the assistance of a national sustainable healthcare unit, and ensuring we have energy policies that help the transition we need to renewable energy. Collectively, as doctors, we have led and we can lead to create change. We have a proud history of influencing public policy to protect health. We did it with tobacco, and we now need to do it again, and we need to do it urgently. We learn through medical school and in our training to translate scientific evidence and complex problems, to present the facts and communicate the solutions. We are generally a trusted and respected voice, and we can use that to cross political and ideological and cultural boundaries. Importantly, as this editorial points out, we need to address the root causes of climate change. And in Australia, as they bluntly put it, it is our fossil fuel industry's grip on not only the public and political discourse, but our energy infrastructure and also our economy. As doctors, I think we all learn to identify and address root causes in our medical practice. And we've done that as well when it comes to the root cause of climate change, particularly coal and its impact on global warming and more so the local health effects. We also know when to raise the alarm. And in 2019, way before the Black Sunday fires, medical organisations around the world and in Australia came together to declare climate change a health emergency. And the AMA and DEA and many colleges were among them, calling on governments to act to urgently reduce our emissions to protect health and avert this emergency. When 2020 brought COVID, I think it's fair to say that doctors even found their voice further. They became louder in presenting the science and speaking out to protect health. But at the same time, they also raised their voice in concern that the recovery from one health emergency, COVID, did not exacerbate our other very real health emergency, being climate change. And organisations representing of millions of health professionals around the world, including in Australia, wrote to their leaders calling for health to be at the centre of any economic recovery plans from COVID, and basically the necessity to have a carbon neutral led recovery. And only just last week, the MJA joined the editorials of 17 other international health journals, calling for action on climate change and not to wait until we've got COVID under control, pointing out that many governments met the threat of the COVID pandemic with unprecedented funding, and that such funding was also really now needed to address our climate crisis. Also pointing out the need for the healthcare sector to also move towards being sustainable and net zero emissions by 2040. And we agree with them. And it's why AMA has joined with DEA to call on the health sector to reduce its own carbon emissions to net zero by 2040, with an interim emission reduction target of 80% by 2030. Ambitious emission reduction targets, I know, but what's actually needed if we're going to follow the evidence and be in line with the science to keep our global temperatures to 1.5 to 2 degrees. The health sector, I'd argue, has an added responsibility to get its house in order, lead by example, and make sure that we are part of the solution and not part of the problem when it comes to climate change and reducing our own carbon footprint, which is approximately 7% of Australia's national total greenhouse gas emissions. Last year, DEA released this report, Net Zero Carbon Emissions, outlining the responsibilities, pathways and opportunities for Australia's healthcare sector to urgently reduce our emissions. So finally, if I'd just like to point out that the time to act is now. We've squandered the last decade or two. There is no time for games. All of us, it's beholden on all of us to act to ensure that a child born today doesn't have to deal or be subjected to the extreme weather events, the health threats that a world which is 2, 3 or 4 degrees warmer would bring. Business as usual is just not an option. And us as a health professional need to ensure that climate care is embedded in healthcare, and we do everything in our power to ensure healthy, stable, productive communities. Thank you.
Thanks very much, Eugenie. That outlines where we've been working with the AMA and where we're up to and the urgency around healthcare sustainability. Next speaking is Professor Mark Howden, and we're very lucky to have him. He's going to give us an update on the climate science. Professor Mark Howden is the director of the Institute for Climate, Energy and Disaster Solutions at the Australian National University. He's also an honorary professor at Melbourne University, a vice chair for the Intergovernment Panel on Climate Change, and is chair of the ACT Climate Change Council. Mark's worked on climate change issues for over 30 years. Issues he's addressed include agriculture, food security, natural resources, ecosystems, biodiversity, energy, water, and urban systems. Mark, done it all. Over to you.
Thanks, John, very much for that introduction, and thanks, Eugenie, for organising me to be here tonight. So I'll just give a very quick presentation on what is actually an extraordinarily complex topic, and one which in the recent IPCC report, I think occupied something like 1,400 tightly packed pages of text. Just checking that you can see a full screen presentation. Fantastic. So what I'll cover quickly is the sort of content of just some of the key points here. And probably the first general point that I'd make is that this IPCC report, which is the 6th assessment cycle, so it's been going since 1990, is much more confident than the previous one. So increased information, increased ability to sort of collate that information and analyse that, but also the way in which this report integrates the future projections with the historical information and with our paleo data, the fossil record, which goes back thousands or millions of years, has given us much greater confidence, a whole range of different assessment elements here. And one of the key things here is that this report, instead of expressing human influence on the climate in some sort of probabilistic sense, it actually says now that the human influence on global temperature is an established fact. There is now no uncertainty. So it takes that sort of crutch away from the debate. This is just simply the way it is. So that's this top line head on this particular slide. Human influence is unequivocal. And one of the sort of figures that sort of tries to convey this is the one I've got on screen. So that shows global temperatures going back to 1850. So the 1850 to 1900 period is what we call a pre-industrial period. That's the baseline. And we can see that our best estimate of natural variation in temperatures from solar radiation variation, volcanic activity, has essentially been flat. So there is no particular trend up or down in terms of that natural variation. We get lots of minor blips from volcanoes which cool the world temporarily, but there is no long-term trend. However, when we include the human influence, so we have both human and natural, we can see there is a long-term trend. So this is our best estimate when we combine those two factors. And we can see there's clear space between the natural and the human plus natural component. There is a clear human signal in this. And we can see that that combination of best estimate of human and natural corresponds very closely with the observed temperature changes across the globe. So we're pretty sure, in fact, 100% sure that we're doing this. And in fact, whilst the temperature has gone up about 1.1 degrees on a decadal average, last year was 1.24, 2016 was 1.24. So we're actually above 1.1 on a year-by-year basis. But in fact, if we look at that decadal average sort of number, based on just greenhouse gas emissions, it would have been 1.5 degrees, except for the fact that we're polluting the atmosphere at the same time with things like sulfate aerosols, which cool the Earth down. And in fact, the net result is 1.5 degrees of warming minus 0.4 degrees of cooling because of air pollution. So this is a good news story in terms of warming, but it's a seriously bad news story in terms of human health. And so as we clean up that air pollution, what we're likely to see is more of the warming expressed. So accelerated warming compared with what we've seen. And the thing that's driving this warming is clearly greenhouse gas emissions, particularly carbon dioxide. So the carbon dioxide level at the moment is 417 parts per million. When I was born, it was 317 parts per million. It's gone up 100 parts per million in my life. And currently the level we're at is the highest it's been in at least 2 million years. If we look at other key metrics of what's happening on the globe, things like sea level rise, Arctic ice, sea ice breakdown, and glacial retreat, it's the worst it's been in several thousand years in each case. And the list goes on if I had time to cover it. We've also seen a very strong human fingerprint in terms of extreme events. Now, extreme events are those which particularly impact on human health for obvious reasons. We've seen extreme heat become more frequent and more severe. Just think back a few weeks to the Northwest US-Canada experience. We've seen heavy rainfall become more frequent and more severe. So as the atmosphere warms, it can hold more moisture. So when it rains more heavily. We get a bigger dump of rain when it rains. And we've seen an increase in the proportion of cyclones that are category 3, 4, and 5 that cause the massive destruction to our infrastructure and huge impacts on human health. We've seen drought increasing in some regions, but not all regions. So some places have actually got less drought affected, but Australia, amongst many mid-latitude countries, has been more drought affected. And of course, that impacts on things like psychological health, on mental health of people. There's a strong linkage with some age groups and suicide rates in drought. We've seen fire weather become more frequent and more severe. We only have to think back to our Black Summer, but also to what happens in Chile and California and Greece and various other places around the world where these fires are impacting on human health and the biospheric health. And our oceans are warming, they're acidifying, and they're losing oxygen. That oxygen is fundamental to ocean health and productivity. If we look at what might happen in the future, So these are our climate choices ahead of us. These are the emissions profiles that we could go on. And they range from the very high to the very low and various intermediate scenarios. And what I've put here is the temperature we expect at the end of the century for each of these different scenarios. So if you look at the very high emissions scenario, it's indicative of about a 5-degree warming compared with our historical pre-industrial. And most people don't have a real context to put 5 degrees of global warming in. They know what 5 degrees feels like locally, in terms of weather, but not what that means in terms of global temperatures. And to give you a bit of context, the difference in temperature between our historical temperatures and the temperature at the last ice age was about 5 degrees. So when we talk about 5 degrees warmer, we're talking about an ice age worth of temperature, but in the other direction. And ice ages fundamentally changed the face of the world. They changed where people could live. They changed North America and Europe had 2 kilometers of ice or more over big slabs of it. Our sea levels were 120 meters below what they are currently. That's how much 5 degrees changes the face of the world. We can't expect 5 degrees hotter to do anything except change the face of the world. So at the moment, we're heading a little bit below 5 degrees. It's a little bit unclear exactly where we're heading, but most countries aren't doing what they said they'd do under the Paris Agreement. We're probably heading somewhere a little bit under 4 and over 3. If all countries did what they said they'd do under the Paris Agreement, we'd be heading for about 3 degrees above pre-industrial. 3 degrees mightn't sound quite as bad, but it's still 2/3 of an ice age worth of temperature change. To meet the Paris Agreement goals, which are keep temperatures well below 2 degrees or if possible to 1.5 degrees, we have to go onto the low or very low emission scenarios, which are fundamentally different in character to where we've been and where we're going right at the moment. So if we look at those, essentially on the very low scenario, to keep temperatures to 1.5, we have to go net zero by 2050 and start reducing those emissions radically right now. To keep it to 2 degrees, we have to go to net zero by something like 2070, and we have a little bit more of a relaxed reduction path in terms of our emissions. But really importantly, you hear a lot talked about net zero, but you don't hear much talked in the public domain or the political domain about below zero. Yet that's what these analyses show, is that net zero is only the start of the challenge. We actually have to go below the line. We have to start taking carbon dioxide out of the atmosphere if we're to keep temperatures down to 2 degrees or 1.5. To portray that sort of information in almost exactly the same way, this is the same information, but presented in a slightly different way with temperature going up over time. The couple of key messages here is that under all scenarios, we're likely to exceed 1.5 degrees in the 2030s. On the high emission scenarios, it could be the end of this decade. 2 degrees, we're likely to exceed in the 2040s and 2050s, depending on the emission trajectory. Interestingly, the carbon budget approach, which says how much greenhouse gas emissions we can emit and still be consistent with any given temperature, like 1.5 degrees, gives us about a decade at current rates of greenhouse gas emissions before we have to go cold turkey and reduce our emissions to zero if we're to keep to 1.5 degrees. The importance of a carbon budget approach is it says you can either spend your carbon budget very quickly and run out very soon, or you can spend it more slowly. You can do emission reductions and you can spend it over a longer period of time. You can push out the time to net zero. But the time to net zero and the interim targets, the 2030, 2040 targets, are intimately linked. You can't separate them. Importantly, what this graph shows is that there is hope. If we keep on the very low emission scenario target trajectory, we can not only peak out at temperature increase, we can start to drag it back before the end of the century. We can turn climate change around. And in doing that, we can avoid the potential tipping points, the nasty feedbacks that push up temperature almost regardless of what we do. They're really only likely to cut in if we go above 3 degrees. Now, the last couple of points I'd make is that the consequences of climate change on health are large. This is one study from a couple of years ago which looked at deadly heat stress days, the combination of humidity and temperature, which causes problems for people, heat stroke and death if we don't manage it. The top left-hand panel is the historical heat stress days across the world. The bottom right is what happens under a high emission scenario by the end of the century. And we can see right across the world, the equatorial and subtropical regions, almost every day becomes a heat stress day. Almost every day is a day where active work or play outside could be life-threatening, certainly bad for your health. And that is a really scary scenario. And if we look at sea level rise, which is likely to impact not just our low-lying Pacific Island neighbours and family, but also countries right around this region of the world like Indonesia and Thailand and others, we're likely to see really significant sea level rises. And we already see the sea level rise is accelerating. It's gone up from 1.3 millimetres last century. It's now rising at about 3.7 millimetres per year. But the upper end of sea level rise is actually really blowing out. So this is based on things like Greenland ice sheet breakdown, ice cliff instability. And this report said we couldn't rule out increases above, in a sense, the core sea level rises of 0.5 metre to 1 metre. We could actually get something like 1.75 metres by the end of the century and up to 5 metres by the year 2150. And if we think about the impact on human health and human life and livelihoods, this is a seriously terrifying scenario, and one that the health community and the health science and research community have rightly said, this is not tolerable, we need to act. Thank you.
Thanks very much, Mark. It's pretty sobering, all of those numbers, and certainly we're definitely at the time that we need to be as proactive as we can be about trying to turn this ship around, as they say. So the third presentation that we have is from Nick Watts, who's coming to us from the UK. Some of you would know Nick. He's presented at DEA conferences before. He's the Chief Sustainability Officer in the UK NHS, responsible for its commitment to develop a world-class net zero emission health service. Based in London, he leads the greener NHS team across the country. He's a medical doctor licensed in Australia and the UK, training in public health. And Nick's previously worked internationally as Executive Director of the Lancet Countdown and Lancet Commission on Health and Climate Change. So over to you, Nick. Thanks very much for presenting.
Of course. Thank you for having me. Thank you for inviting me to a place where I don't need to apologize for my accent. Rare these days. Let me be brief, hey. We've already heard why this is important. No one who shows up to a webinar, 300 people, that's incredible. No one that shows up to a webinar like this should need convincing. The climate crisis is a health crisis, right? The NHS, 5%, 5.4% of the country's emissions, roughly the same size as the entire country of Croatia or Denmark. We're a part of that problem. We're good health professionals. We know that we have a responsibility to act on the determinants of health well beyond the four walls of a hospital, well beyond the four walls of a clinic. And we've done a decent job of it so far. Since 2008, we reckon we've reduced our emissions well ahead of the Climate Change Act, somewhere in the realm, and it gets a little fuzzy depending on the scopes, and you've always got to listen to people when they talk about scopes, but somewhere in the realm of around 35, 36% of total emissions we think we have reduced against the 1990 baseline. We're doing it because the climate crisis is a health crisis. We're doing it because we know we are a part of the problem. We are doing it because we have had a good crack at it so far, and as we have, three things have happened. Number one, the air pollution, the air quality around our hospitals, around our clinics, it has improved. You can see it improve over the last couple of decades. Number two, we've saved money. Not a little bit of money, not 1 million, not 10 million, hundreds of millions of pounds as we respond to climate change. And number 3, our staff love it. The NHS is the 5th largest workforce in the world, 1.3 million healthcare professionals. Every year we go and ask them, hey, what do you care about? What do you want the NHS to do more of? Every year they shout back at us, we want to see the NHS act in a more environmentally sustainable way. Primum non nocere, right? It's core to the stuff we train for and the stuff we do every day. I was really scared that when we asked them that in 2021, they would say, actually, could we please focus on COVID? That was not the answer. 92% of our staff came back saying it wanted to see the NHS go further, go faster on its response to climate change. That was a big survey we conducted about a month ago. Really exciting. So that's the why. The what, well, we've had a decent crack at it, 36% reduction against the 1990 baseline over the last couple of decades. Advocating, shouting is critical, right? There are big, big problems and we need big forces, big government forces to shift them, but it's not enough anymore. That was enough a couple of decades ago. It's no longer enough to simply talk about talking about. So the NHS last year, in the middle of a pandemic, 2 things were a priority. Number 1, COVID and the vaccine response. Number 2, building up our net zero trajectory and building up our team. We started in January 2020. It took us a long time to figure this stuff out. It's quite complex. But by October 2020, we were able to be the world's first healthcare system to make a net zero commitment, 2040 for the emissions we control directly, 2045 for the broader profile for things well beyond our control. But we know that we have a responsibility and the ability to influence. To put that in perspective, right, because net zero is a bit of a nebulous concept for something that is, you know, the emissions the size of Denmark. In 21-22, we're aiming for a 1,280 kiloton reduction of CO2 equivalent. Okay, roughly the same amount, depending on the kind of plane you fly, as 1.7 million flights back and forth from London to New York. It's roughly what we think we can take out of the atmosphere each year. And if you hold on for another 2 weeks, you'll see a board report coming out from the NHS. We're watching very, very closely. We've got about 2 weeks left, but we reckon we're dangerously close to being able to say that we've hit our first year reduction target. That's the why and the what. How? Well, the climate's changing. Turns out the climate was everywhere. Turns out carbon is everywhere. Carbon is in the buildings we sit in. It's in the stuff that powers those buildings. It's in the vehicles and the fuel that powers those vehicles that get us to and from. It's in the medicines we prescribe. It's in the mobility aids we send patients home with. When you talk about net zero, 2040, 2045, you don't get to say, which 3 should I do? The answer is all. You do those 3, then you do the next 3, then you do the next 3, you do everything, right? Net zero is reducing emissions pretty damn low. So for our part, just in the last 6 months or so, we've done a couple of things. We've expanded our team, no longer a team of 4 or 5, now a team of 150 scattered across the country, new net zero medicines team, net zero ambulance teams, net zero nursing, clinical teams. We've invested £250 million into reducing the emissions profile of our estate. We've established, or you'll see in a couple of weeks, the establishment of some new net zero hospital standards. Those new hospitals we're building across the country, they're going to be built to the best available standard. And in about 5 years, we reckon we can get them to a net zero standard. Really exciting. We started to incentivize GP practice around the prescription of certain high carbon medications. We've started with inhalers. We've started with anesthetics for our anesthetic colleagues. We're going to expand that over time. It's not a huge amount of money, but it's about 12 million a year, shifting just subtly the dial over to the left, reducing the emissions profile. Lord Bethel, one of our ministers of state, particularly cares desperately about overprescribing polypharmacy. He's made the connection between polypharmacy, overprescribing, and sustainability, and we reckon we can cut the emissions profile of our medicines in the NHS by about 17%. Through a couple of pretty simple interventions there, stuff that no health professional would disagree with. We have emissions in our transport. People might have seen the extension of some contracts for our patient transport across the country, right? We're responsible for, I think, 2 in 20, 1 in 10-ish journeys across England. We're extending our contracts and we're tweaking them. By 2032, we expect every single one of those journeys to be zero emission. And the NHS is gonna do what it can to drive that forward. In fact, we're not going to approve contracts that aren't. Similarly, net zero ambulances, the first hydrogen electric piece coming out, driving from London to Glasgow in time for the UN Climate Change Conference. There's so much, right? And that's probably the thing to convey. Everyone asks, what can I do? The answer is you can do anything. Do the one thing you're going to do. Do it again and again and again. Once you've done that, move on to the next thing and keep going. There's 1.3 million people in the NHS doing that. I bet you we can get to net zero by 2040. I'll finish maybe by talking about the importance of our clinical friends across the system, right? The NHS is one thing, but there's a whole ecosystem out there. Royal colleges, medical nursing, the journals, the BMA. There's an enormous amount happening there. And to be honest, they are driving a lot of this. The work we're doing with that prescribing shift, that's driven by the Royal College of GPs. It was the Royal College of Nursing who said, we're really concerned about single-use plastics and PPE. We want to launch our own gloves off campaign, talking about how we should be reducing our reliance on single-use plastic, bringing in more reusable, sustainable PPE. It was the College of Physicians and the College of Pediatrics and Child Health that really put air pollution, climate change, and health on the map, calculating for the first time national emissions and national mortality, and pretty aggressively arguing with government, and in fact arguing on the side of the inquiry into the first death from air pollution in the country just earlier this year. It was the College of Anaesthetists that helped us get down to just 10% average across the system of desflurane use by volume for our anesthetics. We were really proud of that. They came back to us a couple of months ago and said, that's not good enough. We reckon we can go to 5% in 2022-23. We reckon we can go to 0% by 2025. No more desflurane in the NHS. It's just important to emphasize the role, the importance of our clinical colleagues as we sort of go down this journey. What I would say is that the NHS is moving pretty quickly, taking this pretty seriously. The ambition, the sort of gauntlet has been thrown down. At the moment, we're the only healthcare system out there with a net zero commitment. We will not be the last. This is the direction unequivocally that healthcare is heading. What we need, though, is friends. What we need is Australian colleagues, Kiwi colleagues starting to step up, because the NHS can't reach net zero by itself. It can only do that if this is the direction that healthcare is heading. Anyway, thank you very, very much.
Thanks very much, Nick. That's great. And it's so good to have an example like the UK NHS to follow. You know, you've really been groundbreaking what you've been doing, and hopefully we can tread the same path and even beat you to that net zero. How would that be? That's a nice challenge. Righto, Omar, over to you, I suspect.
Thank you, John. And yeah, thanks, Nick. We're hoping very much to become your friends. I'm not sure we're going to be leading the charge with the challenges we have, but we're certainly going to do our best to get Australia into the right place. So just for me, I'd like to thank everyone for joining us tonight. I'm here on Wajak Noongar land here in Perth, where it's still sunny and we're still able to walk out and about and see other people. So apologies to everyone else who isn't in that situation. I would like to also pay my respects to elders past, present and emerging, as well as any Aboriginal or Torres Strait Islander people with us tonight. And thanks also to our 3 previous speakers. It's really important that we base these kinds of discussions on science, that we hear from the experts, and we're hoping to take that and translate it, I guess, into what we can do as a profession, both as individuals and collectively, to make a difference here. So I'm here, of course, as president of the AMA, and we have been advocating for action on climate change for a long time now, since the early 2000s. And it's been very clear that this is not just a climate risk and economic risk, it is very much a health risk. And more we've been pointing that out over recent years. We've already seen the impacts on our patients. of the changes that we're already seeing in the climate. And of course, we're seeing horrific events around the world that lead us to fear what is coming even more. We clearly need to do something now in order to prevent extraordinary impacts on our patients, on respiratory complications, mental health, and many other chronic diseases and other insect-borne diseases and so on. So we have, as Eugenie mentioned before, called for a national climate change and health strategy. We've called for a sustainable development unit. We've called for an active transition to renewable energy for our entire economy, and of course in our health sector. And we're hoping with DEA to lead that discussion throughout our health sector to get ourselves into a leading position with respect to the rest of the Australian community. We need to point very much to this being the health emergency that we officially declared a couple of years ago, because it clearly is. And I think the pandemic that we've just had has indicated to us that we can act fast, we can make changes when we perceive the urgency of it. And I guess the challenge for us here collectively is to remind our politicians and other decision makers of the urgency of action here. So we are running a little late, so I'll go straight on. We have brought together tonight 13 of our colleges, our specialist colleges, to talk about the impacts of climate change on their specialty, what their colleges are doing. It's fantastic to see such a strong response from our colleges. It does show how seriously they're taking the issue and how important it is that we have fora like these to discuss what we can do together to learn from each other and move things forward. So I would like to hand over now to John Bonning. Before I do so, I'm just going to remind all our next speakers, you've got 4 minutes each. I'm going to time you and I'm going to interrupt you at 4 minutes. I really apologise for that. But at the end of the day, we've got 13 speakers and we've got to get through this. First, the College of Emergency Medicine and the President, Dr. John Bonning.
Kia ora tātou katoa, ko John Bonning, takiunga, John Bonning coming to you from Aotearoa, New Zealand, across the Tasman, President of the Australasian College for Emergency Medicine. 4 minutes, better go fast. There's a bit to cover. Emergency physicians, we know a climate emergency when we see one. That's why in 2019 we declared a climate emergency along with several other colleges. And our college continues to advocate for better climate policy. EDs binationally are already at capacity and even before the pandemic, and we simply can't afford to be flooded with more patients. This can also be seen as a global sustainability and equity issue. And we're seeing in the short term how the COVID pandemic is exaggerating global and community inequity, vaccine availability, disease impact, for example, all tied to the all-important resource stewardship of our rare and precious healthcare resources. And the impact of climate change will be overwhelmingly worse for those who are socially and economically marginalised in our communities, low middle income countries and Indigenous peoples. Emergency medicine is at the front line of dealing with the impacts of adverse climate events, bushfires, floods, cyclones, as well as the more slow burn health issues, pardon the pun, that come with rising temperatures, increase in vector-borne diseases expanding from the tropics such as malaria, changing mosquito distribution, heat-related illness and worsening respiratory illness due to air pollution. COVID-19 again has shown us that the capacity and capability of the Australian public hospitals and EDs are stretched to the limit. We are currently not equipped to respond to high impact disasters in both metro and non-metro areas. We have neither the bed capacity nor the workforces. You can see here an example of the impact on emergency medicine. The slide shows ED presentations will increase considerably on hot days in the future under most population growth and climate change scenarios. Heat waves have only relatively recently been recognised as a significant threat, but are a significant cause of morbidity and mortality, having caused more deaths in Australia over the last 100 years than any other natural hazard. Heat illness increasingly common, especially in the elderly and those in poorly ventilated and overcrowded housing. For example, a 2014 heatwave in Victoria, there were 167 excess deaths attributed to that. And these events can also impact on health systems, our health systems' ability to provide when power outages and transport and workforce disruptions occur, disrupting supply chains. So to the next slide, what can we do? Leadership and advocacy. Our organisations all have the ability to lead by example. We're highly trusted members of the community and must lead both the advocacy debate and and set standards. We have access to decision makers, politicians, and the media. And ACIM recently launched its environmental strategy and action plan, which will allow us to reduce our own footprint over the coming years. There's research into the impact of climate change, and we've heard some of that. Partnership with a range of organisations, including Indigenous and other community organisations. Education regarding the effects of climate change into our curriculum. Culture, promoting a culture of sustainability and equity in EDs. And speaking of culture, advocacy and leadership, climate change is a critical global issue, and I believe the sustainability and resource stewardship of our rare and precious healthcare resources are inextricably intertwined, and Nick Watts has just mentioned that. So choosing wisely is something that ACIM has championed in both Australia and New Zealand. Many of the colleges were here today have been involved in choosing wisely, but I believe it is an underutilized resource in considering how to reduce waste in our work. And of course, choosing wisely means choosing equity. So reallocation of resources away from the wide well to those who really will benefit. So the key messages from us at ACIM: emergency physicians have a crucial interest in addressing climate change, as we will be the front line, both when disasters strike, as well as conditions for optimal health deteriorate over time, as well as dealing frequently with those exposed to the social determinants of poor health. Current hospital capacity cannot sustain anticipated impacts and increased demand, and we're concurrently fighting to reduce carbon emissions and preparing for the emergency that's here now. As doctors, we have the ability and responsibility to lead the debate. Thank you very much.
Thank you so much, John. You're only a few seconds over, so well done. And thank you for speeding all that up. Really, really interesting. We're going to go next to the College of Physicians and Professor Lynn Madden.
Thank you very much indeed. So climate change and health is a strategic policy and advocacy priority for the RACP. The college is committed to bringing medical expertise and a focus on human health and justice to the centre of public policy as it relates to climate change. The RACP has 3 position statements on climate change and health, and they are listed here. The RACP members guide our climate change and health work, and we have 2 climate change and health reference groups, which have slightly different functions each. Interest in climate change has increased across the college in recent years, and this allows us to draw on the expertise of the 33 medical specialties, including public health, adult medicine, and paediatrics. The college advocacy work is primarily directed at the Australian government. Our current calls for action are listed here on this slide and include a national climate change and health strategy to coordinate action on health-specific climate adaptation and mitigation across the country, and an urgent transition from fossil fuels to zero-emission renewable energy across all economic sectors. In 2015, the college divested all its financial holdings directly listed in fossil fuels, and we did this just before the COP in Paris. The college is also committed to reducing its own carbon footprint and increasing sustainability of healthcare through its CPD offerings. We contribute to significant climate change and health projects. Since its inception, we have contributed annually to the Australian policy brief of the MJ Lancet Countdown, also released prior to the COP, and we're a member of the Climate and Health Alliance and partnered with them recently on the Real Urgent Now project. We regularly respond to public consultations in recent months, provided feedback on the WHO draft COP26 special report, the health argument for climate action, and we also responded to the Victorian Government Health and Human Services Climate Change Adaptation Action Plan. Our key priority for 2021 is our climate change and health research project. The project will produce a research report on the risks of climate change to the Australian healthcare systems and how best to manage these risks. 9 other medical colleges are participating with us in the project, and they are listed here. They have each contributed to our advisory committee, and that advisory committee provides direction and expert input. We've engaged the Monash Sustainable Development Institute and the Climate and Health Alliance in partnership to deliver 3 research outputs: a systematic rapid review of how health systems are responding to the threat of climate change, a series of case studies, and a policy and institutional analysis. Early findings show that despite a growing number of players taking action to address the impacts of climate change, coordinated system-level action is lacking. The case studies are quite compelling and very upsetting. And look at the responses to the Black Summer fires, rising sea levels in the Torres Strait, and the compounding impacts of drought, heat, fire, and the pandemic on local communities. The case studies make clear the strain that climate change places on the health system and on health workers, and make a compelling case for urgent action. Our goal is to unite medical colleges as a collective force for advocacy around this report, emphasising that climate change is a health issue requiring decisive action urgently. We aim to release this report in time for COP26 in Glasgow. Thank you very much for the opportunity to contribute.
Thank you very much. You were exactly 4 minutes. That was amazing. I'd like to move on now to College of Anaesthetists and Dr. Scott Marr, who's on the Council of the College.
Thank you. My name's Scott Marr. I'm a member of council at the Australian New Zealand College of Anaesthetists. I'm joining you from the traditional lands of the Kaurna people. I want to thank the AMA and DEA for inviting me to present at what ANZCA has been up to in the area of sustainability. Go to the next slide. At ANZCA, we are committed to minimising the health impact of climate change and promoting environmental sustainability. We understand that our specialty of anaesthesia is particularly unique because our day-to-day clinical activity, the administration of general anaesthesia, has a significant emission footprint. As Nick Watts described earlier tonight, within the UK's NHS, it's estimated that 2% of its total carbon footprint is attributed purely to inhalational anaesthetic agents that we use. ANZCA Council supported the establishment of an environmental sustainability working group that has operated over the last 2 years to understand what the college and the profession have been doing and what we could do better. The final report of the working group can be found on the college's website. At an organisational level, ANZCA Council recognised the need for action on climate change and released a statement outlining how clinicians and organisations should work together to reduce their environmental impact. We have reviewed our investment strategy with the aim of reducing our investments in the extraction and processing of fossil fuels. At our Melbourne offices, there has been significant progress in diverting waste from landfill with activities to promote recycling and composting. We hope to undertake further activities to reduce our carbon footprint by understanding our energy use so that we can consider whether on-site renewable energy production and storage is feasible. Our college events for several years now have engaged with suppliers that have good sustainability credentials, and college-related airline travel have been offset through one of the country's largest biodiverse reforestation developer. On the next slide, with the profession, ANZCA has developed a professional document that has summarised how clinicians and facilities can be more sustainable. ANZCA PS 64 Statements on Environmental Sustainability in Anaesthesia and Payments Practice is available on the college's website. ANZCA and its Faculty of Pain Medicine has supported the Choosing Wisely program, and more recently we have developed an audit tool that can assist clinicians and departments on ways to achieve sustainable practice. We hope to build on this tool in the future. From an education perspective, sustainability is embedded in our training curriculum, and recently questions on sustainability have featured in our final fellowship examinations. To support education and training, we have created a central resource hub through our online library service, where our fellows, trainees and SIMGs can get up-to-date material on sustainability. With relation to research and innovation, we hope to support trainees to pursue fellowships in sustainability. There is a strong trainee-led group, TRASH, who have already established meaningful impacts through their work in auditing waste management and promoting sustainable activities. Recently, our foundation has created a new environmental sustainability research grant that will support researchers undertaking projects that will promote sustainable practice. Through our relationships, we continue to work with other organisations in this area. The college has supported the Health, Environment and Lives Network application to the NHMRC Special Initiative in Human Health and Environmental Change, and is represented on the RACP's Climate Change and Health Research Project Advisory Committee. Internationally, we recently established the International Academy of Colleges of Anesthesiologists, with the UK College, the College of Anaesthesiologists of Ireland, the Hong Kong College, and Canada's Royal College, who have proposed environmental sustainability as one of the many common interests where we can build on the synergies of collective activities already in place. Looking to the future, Council has approved the establishment of the Environmental Sustainability Network. The purpose of the network is to advocate, collaborate, and promote initiatives and projects related to environmental sustainability within anaesthesia, perioperative medicine, and pain medicine. The vision is for the ESN to position ANZCA as a proactive leader and advocate for sustainability. So I thank the AMA and the DEA for the invitation to speak tonight.
Thank you so much, Scott. It's great to see some of the concrete activities that are being undertaken around the country. I'd like to move on now to the College of Ophthalmologists and Dr. Michael Laughlin.
Thank you very much. 4 minutes and 2 slides. So I thought rather than going through comprehensively what we're up to, I'd focus on one issue. And I think Nick's presentation was music to my ears on this, what they're doing. So the college has a sustainability committee. We're working in all sorts of ways. And one of the key things we're working on is waste in surgery. Our surgery is very expensive. It's very resource and waste intensive. And one of the questions I suppose we want to ask is, what do we get for that? Is this necessary for good quality care? Or in fact, have we just bolted on more regulation, more costs as more things have become available? And all we've done is created a rod for our back with having expensive, wasteful surgery. There's been a few comparisons made, and one I've sort of stolen from a colleague in the US, David Chang. What they did with Cassie Thiel, who did a Fulbright fellowship, compared outcomes from a large centre in India that does over 200,000, almost 300,000 cataracts a year, and compared their outcomes with both regard to surgical outcomes, clinical outcomes, and also with regard to waste and cost. You can see up the top there the difference between the disposables, what goes to waste from one cataract in the US and from 93 at the Aravind Centre in Tamil Nadu in India. Down the bottom, there's a comparison with regard to the waste generation and the cost generation. So do we get much better outcomes for all this extra money? So this is a very good quality study. The outcomes were monitored very closely. You know, the two outcome measures, oh, sorry if you go back to, thanks. And one more back, thanks very much. That we've looked at. One is endophthalmitis rates, a fairly standard outcome. Aravind actually has about a quarter of the endophthalmitis rates than across the US from their studies, and posterior capsular rupture, which is a bit of a surrogate for quality of the surgery. Aravind again is lower. And to generate these outcomes, they use 1/20th of the carbon footprint. So less carbon, better outcomes. Can I advance to the next slide, thanks? Thank you very much. So I suppose the question is, what have we achieved for ignoring sustainability and just focusing on using what we wanted to use in the surgery? What we've resulted in is actually increased cost, increased waste, with no demonstrable better outcome for the healthcare system or for the planet. So I suppose what we're trying to do is to create a preferred practice guideline that will enable surgeons to reject the use of lots of disposables, reject the use of added pharmaceuticals that aren't needed, and provide good quality care without generating so much waste and so much cost. This is not only good for the planet, but in reducing cost, we make day surgeries function better, there's less push onto the health insurance, and I think we better get a better outcome for everybody. So we believe that by creating a preferred practice guideline, we'll enable doctors to make those changes and to have the benefit of having a college backing behind them. So thanks very much. Just one of the things that we're doing, but I think a really important thing to strip that waste out of surgery. Thank you.
Thank you so much, Michael. I think if we all thought about where we waste resources, we'd make a huge difference, I think, to the sustainability of our institutions. I'd like to go on next to the College of Dermatologists and Dr. Austin Anderson, who is a Environmental Sustainability Group member.
Thank you, Omar. I'm speaking from Wajak Noongar land today in Perth, and my first slide is one that you may have seen before from the CDC outlining the impacts of climate change on human health. And this slide attempts to address how climate change is likely to affect dermatological disease presentation. So in the top left-hand corner is an example of hand, foot, and mouth disease. This condition is quite closely linked to heat and humidity, and there have been studies showing that this disease is increasing in frequency, particularly in the Asia-Pacific region, and it's thought that this is at least in part due to climate change and its effects that it's already having on dermatologic presentations. The direct impact of heat has an impact on conditions such as cholinergic urticaria, rosacea, and miliaria, or heat rash as it's commonly known. And it may also have impact on skin cancer. However, the link with skin cancer is difficult because of human behavioural changes associated with UV exposure, but we know that heat is an independent factor that can cause cutaneous carcinogenesis and also ageing of the skin. So probably with increased heat in the environment, skin cancer will increase. The picture in the top right-hand corner of my slide is cutaneous melioidosis. This is a condition that is closely linked to environmental flooding and cyclones, and it has been shown that this condition very closely links with the track of cyclones. And so, as was discussed previously, as storms such as cyclones increase and potentially move to areas of increased populations, these presentations may increase as well. The photograph of the baby on my slide there is a little baby with a condition called acrodermatitis enteropathica, which is a result of a inborn deficiency of a zinc transporter. And so zinc deficiency is something that we see in dermatology also. With increased environmental CO2, zinc levels have been shown to be decreased in crops such as wheat and maize. And so potentially as environmental CO2 continues to increase, so will presentations such related to nutritional deficiencies for us. The slide down the bottom right-hand corner is showing an allergic contact dermatitis due to plant allergens. And increased environmental CO2 increases the growth of some plants. One plant that's been studied a lot regarding this is poison ivy. Poison ivy causes an allergic contact dermatitis in about 80% of people who come in contact with it. And not only is this plant increasing in growth in relation to environmental CO2 increases, but the chemical in this plant that causes allergic contact dermatitis, which is called urushiol, in laboratory studies under increased CO2 conditions, this allergenic compound is increased as well. So you can see that the impacts of climate change on dermatologic disease is quite complex. So just moving on to my next slide, please. So what are we doing as a college? So we have established an environmental sustainability group in February of 2020. And as a college, we have committed to divest from fossil fuels. We've included a focus on sustainability and environment in our trainee curriculum. And we've also developed a college environmental sustainability policy to guide our fellows and registrars on environmental sustainability practice. We're planning a climate and skin summit in mid-2020 to establish a consensus on the impacts of climate on dermatology and pathways for future action. And we're also planning to encourage further research on climate and skin health through our journal, the Australasian Journal of Dermatology, and our annual scientific meeting as well. Thank you.
Thank you so much, Austin. I think the general population would be pretty scared if they saw that list of very visible impacts of climate change just in the one area of dermatology. So thank you for pointing that out to us all. Now I'd like to move on to the College of Psychiatrists and Associate Professor Vinay Lakra, who is the President of the College.
Thank you, Omar. I'm speaking from the land of Wurundjeri people here in Melbourne. Thank you for inviting me. I would start by saying that this is really the future of health lies in mental health, and what better reminders do we need while we are dealing with the COVID issues currently. So really, I think there's no health without mental health. And certainly there is a significant element of mental health impacts of climate change. So there are a number of things which have been happening and which we're obviously aware of, and there's evidence building up. So one is that there is all the extreme weather events, they are associated with increased incidence of mental illnesses. So that relates to post-traumatic stress disorder, depression, anxiety. We've seen that through bushfires, and we've seen that through floods as well. And for many people, those impacts can last for a longer period of time. So for example, some of the outcomes we've seen as a result of extreme events, we've seen that the peak demand for mental health issues comes in 12 to 24 months or so, or even longer. So I think there is a significant burden of disease as a result of these extreme weather events on mental health. The other thing, there's got a bit of work happening currently, and there's increasing evidence around high temperatures being associated with increased rates of suicide. Now, we all know that rates of suicides have been quite static over a long period of time, and a lot of work happening to reduce rates of suicide. But I think this further understanding around how that temperatures can impact rates of suicide is something which can contribute to further reducing the rates of suicide if the impacts of climate change can be addressed. And certainly there is also association with increased rates of hospitalization for mental health conditions, and also mortality for people who have mental illness. A lot of social and economic disruption which is caused by the climate change, that leads to further rates of depression, anxiety, and post-traumatic stress disorder. And this is within the context of the fact that 1 in 5 people experience a mental illness in the 12 months period. So that is data from National Survey of Mental Health and Wellbeing. So that equates to around, there are 327 people on this call here, that equates to around 60 people, 60 amongst us who would have experienced some form of mental ill health during the last 12 months. And then if you look at lifetime rates of mental illness, that is 1 in 2. So I think we're talking about something very, very significant in terms of mental health. And we all know how the current COVID situation has impacted the mental health and well-being, and then of course impacting on various psychiatric disorders as well. The next slide, please. Now, the college has been doing quite a few things over the last few years. One of the key elements is divesting from all fossil fuel investment. So that is a policy in action. So we are progressing that with a view to reduce to zero fossil fuel investment. Our fossil fuel investment currently is less than 5%. So that is something we've been working on over the course of last 12-24 months. As a result of knowing that climate change is a significant issue, so we put together a working group who have started to look at a climate strategy and various things we can do. One of the things the college is really looking at is what we can do as an organization and what individual members can do within their own on their lives. So, for example, the fact that you don't need a plastic water bottle to carry along with you is something which an individual can do. But in terms of what we can do at organizational level is in terms of sustainability, reducing carbon emissions. We all know the impact of COVID in terms of how it has generated interest in virtual meetings. We are in a virtual meeting currently. Otherwise, we might all be meeting in a room somewhere together after spending quite a bit of our time and energy on wasting traveling. So I think that is something which is happening at the organization level, as well as focusing on how we can tell individuals. And then we are planning to finalize the position statement on mental health impacts of climate change and looking at other sustainable practices within the organization. Number of things are around how we provide different things at the college congresses is a good example of it. Thank you.
Thank you so much, Vinay. And I'd like to move on now to the College of Medical Administrators and Professor Erwin Lowe, who's our board member at the college.
Thank you. Like Vinay, who's also a fellow college, actually, I'm calling in from the lands of the Wurundjeri people. I actually want to acknowledge that they have occupied and cared for these lands over countless generations in such a way that we can all learn from. And I celebrate their continuing contribution to the lives here. Now, RACMA as a college, we celebrated our 50th year anniversary in 2017, the college having been founded in 1967. And at that point, as a college, we were looking at horizon scanning. What 5 strategic health concerns and threats would the college and health as a whole face? And we looked at the aging population, rising health costs, antimicrobial resistance, geopolitical tensions, but the 4th thing was climate change. At that point, we were understanding that climate change was going to continue to impact health systems directly through climate-related disease, such as heat waves, and some of the other speakers have talked about some of the health impacts directly, but also indirectly through things like forced mass migration. Next slide. So this year, the college developed a climate change position statement. This is still draft. We're still consulting our members through this, but because we are a college of hospital administrators and medical leaders, really there were 4 areas that we think that we can play a role in as a college. First was through role modeling. So as a college directly, we believe we can reduce our carbon footprint, we can reduce waste. So that's one thing. But through our members, through system leadership, we've got fellows and members across the health system. They can help to design future infrastructure that is more sustainable. They can look at how models of care can be changed so that care is moved outside of the hospital walls, which again leads to a better use of resources. Developing new work practices to reduce waste, we refer to choosing wisely. I'm a member of the advisory group for that, and that's something that we can look at. And as we become more sustainable, that actually has a financial impact. You can actually reduce costs in the longer term. So that's number 2. Number 3 is collaborating. So just like what we're doing today, we're partnering with other organizations, other colleges like yours. And in the longer term, helping to plan services to address the health impacts of climate change into the future. So looking at how we can design systems to address the rising chronic disease that might happen due to respiratory illnesses, infectious diseases. We've talked about zoonotic diseases that might rise because of the change in climate. And the 4th is really to be a college of advocates. So that we can advocate for those who are most at risk due to systemic inequalities. People who are more vulnerable appear to be disproportionately impacted by a changing climate. And so we want to be on the front foot and to advocate for those people. And in the end, to be a voice for them to government, to health leaders, and to the community. Thank you.
Thank you very much. I'd like to move on now to the College of Sports and Exercise Physicians and Associate Professor Kallen Broderick, Fellow of the College.
So, Mara, I'm joining you from Gadigal Land in Sydney tonight. But the Australian College of Sport and Exercise Physicians, it's a small college, but we're strongly committed to addressing climate change. And we have really 2 broad objectives. Firstly, to reduce our contribution to carbon dioxide emissions in the way that we conduct our business. But secondly, we aim to contribute our expertise to keep the population active in what looks like being a much hotter environment. We know that the impact of global warming on our specialty will be significant, with an increase in the number of extreme weather events that impact on people's ability to be physically active and play sport. And so here, for example, in my role as Medical Director of the Australian Open, I've observed firsthand the enormous challenges that climate change brings. For 2 of the past 4 years of the Australian Open, we've had to suspend play as a result of extreme heat. And for 1 of the last 4 years, we've had to suspend play because of bushfire smoke. And most of our college fellows have had similar experiences in the community and professional sports that they manage. But it's not just a problem of professional and elite sport. I think without significant interventions, the risk of exertional heat-related illness in the population will increase. Research shows that people's physical activity decreases at average temperatures that exceed 29 to 30 degrees Celsius. And projections indicate that by 2070, there'll be parts of Australia that can expect an 8 to 50-fold increase in the number of days that will be unsafe to perform moderate outdoor physical activity. We've recently contributed to the Lancet Heat and Health series that was published last month, looking at the impact of rising global temperatures on sport and physical activity. And in the second paper in this series, it focused on sustainable cooling strategies and how we can reduce the health costs of hot weather. But in terms of what the college has done, we've come with a renewed commitment to acting on climate change. Our members and fellows are geographically spread across Australia and New Zealand, but over the past 18 months, and I'm sure with many other colleges during the COVID pandemic, we've learnt to do things differently, and many of these changes we aim to continue with. So in particular, we've learnt that we don't need to travel so much. Virtual meetings of our executive will become the norm unless there's compelling reasons to meet face-to-face. We're going to continue with our regional sub-hubs for fellowship clinical exams to minimise travel. We'll be conducting our selection interviews online for training positions. And we'll also continue to grow our online training resources for fellows and registrars to minimise the need to travel for workshops. Colleges are divested from fossil fuel investments. And so in the future, to conclude, our college will commit to the medicine that we practice, which is exercise prescription. And that is encourage ourselves and others to be more physically active, to leave your car at home, to use active transport and contribute to a carbon neutral future. We will partner with others and support collective college climate change initiatives. One of the advantages of being a small college is that we're nimble and we can implement change relatively quickly. But we'll also continue to work with sporting organisations to ensure the design of sustainable sports facilities that take into account the impact of heat, things like ventilation, shade, green spaces, reflective roofs. We'll partner with sporting organisations to develop evidence-based extreme heat policies. This is an example of one in the slides here, where we developed heat policy for sport aimed at having stepwise interventions for various thresholds of risk. And importantly, we'll educate the population on how to stay active yet safe in a hotter climate so that we don't contribute to that other great burden of disease, which is physical inactivity.
Is that the end? Thank you, Carolyn. Sorry, you caught me not ready. I think it's really interesting. We're starting to see some very consistent themes from all the colleges in terms of your actions and your plans going forward. So thank you very much for that. Apologise for the camera, it's running out of batteries. I'd like to move on now to the College of General Practitioners and Dr. Karen Price, President of the College.
Oh, well, thank you, Omar. And it's not Dr. Karen Price, it's Dr. Lara Roweski on her behalf.
Okay.
So good evening, and I am joining you from the Wurundjeri lands in the Kulin Nation. I'd also like to thank the AMA and Doctors for the Environment Australia for the kind invitation to contribute to the panel. Can I just check you can hear me there?
Yep, got you loud and clear. Thanks.
Thank you very much. So I'd now like to, and actually we don't have the right slide up, but that's okay because I probably prefer not to speak to any slides this evening. I'd like to now provide an overview of the work underway by the RACGP across key domains of policy, advocacy, governance, resources, education and training. The RACGP supports over 44,000 GPs training towards or working in general practice across a hugely diverse range of settings, remote, rural and metropolitan Australia. Before I go on, I also want to acknowledge other colleges here, including leaders and agents in this space that we have been able to collaborate and partner with and look forward to ongoing work and collaboration. So in June 2019, the RACGP published a position paper on climate change and human health. The college's position is that it recognises climate change as a key public health issue. It commits to mitigation and adaptation strategies as an organisation and also promoting and advocating for these among GPs, healthcare organisations and the community. It advocates for policies to protect human health from risks of climate change at local, state, national and international government levels. And it considers it important for GPs to understand and communicate the causes, health risks and consequences of climate change, as well as mitigating actions and adaptation to climate change at individual and population level. The The RACGP's position statement notes that GPs play a key role in identifying, reducing and managing adverse health effects of climate change on Australians and the international community as well. The role includes identifying patients who are particularly at risk from climate impacts and ensuring patients have access to public health advice, promoting urgent mitigation action and leading responses to the burden of chronic disease. In December 2019, amid the unprecedented bushfires and associated air pollution, the RACGP publicly declared climate change to be a health emergency. In that statement, the college committed to advocate for policies protecting human health from climate change risk at all levels of government. The RACGP also called on the Australian government to do more to recognise and help address the health impacts of climate change. In 2020, the RACGP joined the other peak health bodies in Australia to call on the federal government to protect the health of Australians by acting on climate change as part of its COVID-19 recovery. In May of this year, the board discussed and noted the nexus between climate change and environmental sustainability and health outcomes, and reinforced the importance of RACGP operating in a manner that supports environmental sustainability. It was determined to include climate action and environmental sustainability action in the next RACGP strategic plan and to take meaningful action immediately. Our General Manager of Operations is leading work on the actions we are taking now before the next strategic plan is in place. The RACGP has an environmental and social governance investment policy which outlines the college's aim to avoid investments which fail to adhere to a morally positive, sustainable approach to the environment and society, or that cause unacceptable human harm. This includes excluding industries such as coal mining and oil and gas extraction. Now, I'd like to give some examples of recent college initiatives.
Lara, can I just interrupt you? You're over time, so can you maybe give us a sentence or two to sum up? We need to move
Absolutely.
on.
Yep. Sorry about that. Yep. Yeah. I'm proud to chair a large group of GPs. We have a specific interest group known as the Climate Environmental Medicine Specific Interest Group. This represents 1,000 GPs across the nation. Actions being taken by that group include advocacy submissions, collaborations with state government and with national government, also collaborating with our Aboriginal Torres Strait Islander faculty, the development of webinars, educational resources to support practices to be sustainable and to continue to support the education of our members. Thanks, Omar.
Thank you so much, Lara. Great to hear of that enthusiasm, and having 1,000 members involved in anything is quite extraordinary. So well done. If I could now go to the College of Surgeons and Dr. Sally Langley, who's the president. Hopefully. Have we got Sally online?
Thank you, Omar. Can you hear me?
Yes, got you on. Got you now. Yes.
So is my slide coming up? Oh, I just go share.
Yeah, you got to share. Yeah.
Good evening. Thank you to Omar and to John van der Kallen for asking me to speak on behalf of RACS. I acknowledge the speakers who've gone before me. I'm a plastic surgeon in Otautahi, Christchurch, New Zealand, and the local people here are the Ngāi Tahu. Climate change, the environment, and surgery. Sorry, my slide's still not there, is it?
We've just got your desktop there, Sally.
There it is. That's showing up now.
Yeah, that's great.
So climate change, the environment and surgery have been discussed over the last few years at RACS Council and at Aotearoa New Zealand National Committee. We had the Environmental Sustainability Working Party, and now we have the formal committee chaired by David Fletcher. This part of that's now part of the Health Policy and Advocacy Committee chaired by Mark Frydenberg. In Aotearoa, New Zealand, we also have active committee members such as Andrew McCormick, General Surgeon from Tamaki Makaurau, Auckland, and we've had discussions with respect to supporting Orotaio, the New Zealand Climate and Health Council. Recently, Mark Smith, General Surgeon from Otipoti, Dunedin, spoke at Surgery 2021, our national meeting on climate change and the environment. We've set up a number of educational initiatives. There's a recent podcast by Ben Dunn, cardiothoracic surgeon in Melbourne, which summarises our concerns for surgical practice. A webinar is also under development. RACS has looked at the important statements and open letters for co-signing. So this just shows me this morning a bit fed up with the amount of plastic and rubbish that we have to open in the operating theatre. RAC's position paper, Environmental Impact of Surgical Practice, delivers the message of the 5 R's, and these are common guidance to all of us. Reduce. We must reduce consumption of products by carefully planning procurement, surgical decision-making, and surgical planning. We are talking these days about low-value procedures, futile surgery, for example, at the end of life, and we've had the Choosing Wisely initiative over the last few years. We need to be more aware of what is opened for use in our operating theatres and make sure that surgical trays and products are not opened unless used. Packaging can be excessive, as is demonstrated here. Where we can, we should try and purchase products which have less packaging. We've taken on disposable single-use products for convenience and for infection control reasons, and we must look at changing back to reusable, re-sterilisable where we can. There is, of course, a financial and environmental cost to reuse and recycle, but this needs to be analysed for different types of products. COVID has upset this direction due to our greatly increased use of PPE and other operating theatre behaviours. We use disposable gowns, but should be using cloth gowns and drapes that can be laundered and re-sterilised. Recycle. We've become a society where we discard stuff, and a lot of it is not repairable, but we now should change our practices and look at products that can be fixed and put back to use. I will be carefully watching our move to robotic surgery. There's no doubt that this is leading edge technology, but we need to watch this carefully since robots and similar machinery will have a limited life and then go to the graveyard. We need to look at sorting our rubbish. And we need to rethink. COVID has made us change to doing more patient care via telehealth. This is more convenient for the patient who doesn't have to travel and can have an appointment over the phone or video at home or at a clinic close to home. This telehealth patient care change must continue. And we healthcare professionals are attending conferences, courses, and committee meetings without travel now. And we must gather the required data in our hospitals to help our decision-making and advise the administrators of our hospitals. We need to establish sustainability officers. We must look at what we can do from our own personal point of view, our own organisations, and through to the hospital system. As surgeons, we must use our influence for the benefit of the environment. Thank you, Omar.
Thank you so much, Sally. And if we can all implement those 5 R's, I think along with what some of the other colleges have been saying, we will certainly be able to make a big impact ourselves in our workplaces. I'd like to move on now to the College of Intensive Care Medicine and Dr Mary Pinder.
I'm also speaking to you this evening from Wajak Noongar land over in the west, and I'd like to pay my respects to LDA for inviting me to present on behalf of the college, and
Mary,
my admiration together assuming in terms of intensive care is, yes?
We're having trouble, I think, with your internet connection.
Yes.
Do you have an alternative way to come? Maybe video off? Yeah, it's really
Sorry, is my internet breaking up?
Oh, that's much better now. Maybe leave your video off. Thanks. Sorry about that.
Yeah. Yeah, so if it's very similar to other colleges. I think one of our great strengths as well is that we are reliant on a multidisciplinary team for patient care. And we're also doing a lot of work as a multidisciplinary team in terms of sustainability and action on climate change. And I'd like to acknowledge the work of our fellow organisation and six in particular for work in this space. So we've had some conferences focusing on climate change and sustainability, an ICU sustainability toolkit. And I'd like to acknowledge the fantastic work that Lou Trent, Forbes McGain, and Deepak Bonagiri have done, and also in association with David Gala, Helen Polly, Debbie Wilson, Hayley Bennett, Jessie Smith, Tanya.
I'm happy to speak
Mitchell, and Matt Anstey. The toolkit, ICU, and it covers not just the three that we've added, looking at views as well. The personal working in team waste, looking at pharmaceuticals, looking at policies, and also looking at individual patient management system by system. Other initiatives, as I said, are very similar to other colleges, collaboration, local and regional initiatives with champions. We're establishing a special interest group. We've moved as a college to an ESG investment portfolio, and we're looking at sustainability features for our new office build. Next slide, please. And again, I think just there, we're the next step from emergency departments. So everything that John said applies to us. And in particular, I think we need to be mindful of Indigenous health issues, the effects of depression and mental health. People feel that sometimes the whole situation is hopeless. And similar to surgeons and anaesthetists, our use of energy and consumables and the waste from that, and that's other areas particularly we want to target and work on. Thank you.
Thank you very much, Mary. I think we got about 80% of what you said. Forbes, did you have any couple of sentences you wanted to add just to, in case any of the points were missed?
Thank you very much. No, it's really just to say great work by all of the colleges and the College of Intensive Care, which I'm a member, and the ANSCA as well. And it's just fabulous to see what's going on more broadly for all the colleges stepping up and making a difference, I think. So thank you.
No worries. Thank you very much for your contribution. I'd like to go now to the College of Rural Remote Medicine and Dr. Rob Fair, who's a counsellor.
Good evening, and thank you for having me. I'm calling to you from Gunai-Kurnai country in Victoria, representing the Australian College of Rural and Remote Medicine. So ACRRM recognises climate change as a rural health emergency. My college acknowledges the significant and overwhelming evidence which tells us that the impacts of climate change have created a global health emergency. These effects are being felt especially by rural and remote communities in Australia and around the world. Rural doctors look after rural communities, and we know that rural, remote and Indigenous communities are already disadvantaged. On top of that, our communities are among the most exposed to impacts of climate change. We witness these impacts firsthand, and the complexity and scope of impacts can be overwhelming, as Mark Howden suggested. ACRRM members overwhelmingly support strong action, and we've found a highly diverse range of local solutions. The impacts we witness in our rural communities include extreme weather events, rainstorms, floods, heat, drought, bushfires, air pollution events, and in recent times we've seen some of these events affecting major sporting events, which is something we hadn't seen before. Tropical and vector-borne diseases such as melioidosis, mentioned by dermatological colleagues before, Also direct impacts on sources of incomes and livelihoods, such as with farmers or with pearl farmers, and the accompanying impacts of trauma and mental health. One aspect is that we witness that these events have major impacts on our doctors as well. Self-care is a major issue. So rural generalist medical practice is based around providing the highest quality care close to home in our communities. And we work in resource-poor environments, and a necessary integral part of our practices is efficient use of limited resources. So in that sense, I think our fundamental ethics are pretty close to significant action on climate change. We know, for example, metropolitan sites can be extremely resource intensive. Rural generalist doctors are used to dealing with other specialties and building networks. We're jacks of all trades. We're not experts in any one area. And beyond health, we do seek to engage with many other sectors, including, for example, the agriculture sector, Farmers for Climate Change, for example, federal, state, local government, and in this context, also climate scientists and climate policy experts. Many of us have been involved in immediate political activism, and as we've recognised that some of our politicians haven't been advocating for the kind of urgent changes that we need. So, going back to my slide, we've seen that climate change impacts very significantly on the economic status of our communities and the social determinants of health, and it has significant impacts for rural medical practice. So, in addition to developing more detailed policy responses, ACRIM is committed to progressing towards reducing its own organisational carbon footprint, educating and supporting members and moving towards more environmentally sustainable practice. And as I said, this takes many and diverse forms. Our College Council has identified climate change as a health policy priority. We move on to the next slide. So there's a whole range of solutions which have been identified in our communities in terms of adaptation and mitigation. The standout example over the last year or two has been the way in which we've been able to use telehealth and virtual solutions to solve a lot of our problems. These are in fact techniques that we've been using for many years in rural context. And it's been fantastic to see our other colleges and our specialist colleagues also embracing these in times in the COVID context. We've mentioned the Choosing Wisely initiative. For us, that's a fundamental part of our practice, especially in contexts where we don't actually have access to certain imaging modalities, for example. Our responses included presentations at our rural medicine conferences, a sustainable events policy, ongoing policy development work, review of our curriculum and all of our training programs to reflect the desire of our trainees and the desire of all of our membership to integrate climate change as part of our rural generalist practice. We also look at providing support for members and communities affected by natural disasters in the short and the longer term. And we're very keen to support rural research into the health impacts of climate change. Above all, as I said, we are extremely keen to engage and advocate together with other colleges and organisations. And I'd like to thank Doctors for the Environment and the AMA and all of the other college representatives for contributing to tonight's session. Thank you so much.
Thank you very much, Rob, and also for the reminder about the place of technology in the solution to so many of our climate change debates. And it is interesting that in Australia, we've got this kind of rural versus city political divide where it's perceived that climate change is an inner city kind of champagne drinking socialist group that it affects and everybody else is opposed. And so it's really good to say that there is concern right through our community. Up to our very last college now, the College of Obstetricians and Gynecologists, and we've got Dr Christine Barden, who is a fellow of the college, joining us. Thank you.
Hi, thanks, Omar. I'm talking tonight on Muanina country in Nipaluna, Hobart. So in our 2019 statement on climate change, RANZCOG has acknowledged the imminent threat that climate change poses to human health and health systems and the urgent need to limit greenhouse gas emissions and environmental degradation. Our immediate concern is women's health, and women are particularly vulnerable to the health and socioeconomic repercussions of climate change. This is partly related to physiology and to specific vulnerabilities during pregnancy, but the main factors are women's existing socioeconomic status and socially designated caring roles. Worldwide, women and children are 14 times more likely than men to die during a disaster, and women make up over 75% of people displaced by climate change. Gendered effects of disaster, including a spike in domestic violence, are seen in Australia and New Zealand for the very simple reason that inferior socioeconomic status and increased work of caring also apply here. Effects of heat, air pollution, stress and poor diets in pregnancy are related to increased rates of stillbirth, gestational diabetes and hypertension, fetal growth restriction, and preterm birth. Pregnancy complications have repercussions for the lifetime health, both physical and psychological, of mother and baby. The environmental effects in pregnancy today are creating a new generation with increased vulnerability and decreased resilience to the environmental health threats of the future. Second slide. As advocates, we feel that our greatest impact will be in working together with other colleges and health organisations, so we're very welcoming of tonight's initiative and any other opportunities that we have. We need to prioritise population groups who will be disproportionately affected by climate change, including First Nations people and our Pacific Island neighbours. And we believe that developed countries have an obligation to support, particularly our neighbours in the Asian Pacific. Earlier this year, we worked with colleagues from Public Health to produce a comprehensive resource on air pollution in pregnancy, which is aimed at clinicians and the general public, and another resource on heat in pregnancy is planned. We had a focus on climate change and sustainability at this year's ASM, and that was strongly supported by attendees. We're currently in the process of establishing a climate change and environmental health working group, and the aims of this group will be to raise awareness of climate issues amongst the membership, offer opportunities to become involved in advocacy, encourage research, and provide information and resources on reducing the environmental impact of healthcare practices. Finally, at organisational level, we have developed an environmental sustainability policy that embeds sustainability into all college operations. Environmental sustainability was a major consideration in the design of our new college offices. Carbon offsetting applies to all college flights, and meetings take place online where possible. An internal environment committee has introduced numerous initiatives, and these include recycling, green waste collection, purchase of sustainable products, and encouraging walking, cycling, and carpooling. These activities, we think, position us well to achieve our aim of becoming accredited via Pangolin Associates as a carbon neutral organisation, hopefully as soon as 2022. So that was it. Thank you.
Thank you very much, Christine, and in particular for that reminder of the uneven impact that climate change is going to have on women in our societies due to their roles and those other factors. And again, also for hearing what action you're taking. So look, I have to say I'm pretty proud as a doctor to see the amount of activity that's going on amongst our various colleges, the leadership that each of our colleges is taking in this area, and in particular, the commitment, I think, from pretty much every college that's spoken tonight to work together as a profession to make this real. The challenge, I think, for all of us is how we turn this talk into action, not just action for others, but action for us as individuals, action in our workplaces, in our homes, in our cars, our offices, and of course, our hospitals. So to that end, I'd like to introduce our final speaker and coordinator for the rest of the evening, Dr. Kate Charlesworth. She's a public health physician in Sydney, and after working as a public hospital doctor, she completed a lot of her public health training in the UK, including at the NHS's National Sustainability Unit, the precursor to the Greener NHS program that we've heard about earlier tonight. Kate is a real doctor. She's got a PhD in low carbon healthcare. And she works as a medical specialist in climate risk across Sydney North Primary Health Network and the Northern Sydney Local Health District, the first such role in Australia. Kate's going to give us a bit of a synopsis, and then hopefully we'll get a little bit of time for questions, although we are running over time. Thank you, Kate.
Thanks so much, Omar, for that. Yeah, so I have the unenviable task of trying to pull all that together, bring together some themes and some of the key issues. Look, the most obvious thing to say is it's tremendous to see the AMA, DEA, and almost every medical college in the country on this call today, and about 350 people online at some point. What was coming up a lot in the chat is that it's tremendous to see that, but really, as Omar called out, the really key task for us is about action now. And I think this forum has been really useful for every college to see what everyone else is doing and to be able to bring those ideas together. So, I mean, as I said, I'm going to try and pick up on some of the sort of highlights I've heard this evening. The task for us really, for medical colleges, there are a couple of things we need to do. One of them is to get our own house in order. That is about decarbonising the healthcare system. One of the earlier questions on the chat was, Eugenie pointed out that our health system is 7% of our national emissions. And what's the breakdown of that? We know that it's not just about solar panels on hospital roofs. Of our carbon footprint in our health system, about 40% is buildings, energy, and so on, but 60% of it is clinical care. Okay? It is pharmaceuticals. That's 20% of our whole carbon footprint is pharmaceuticals. It's medical devices, equipment, it's all the stuff that we use, it's anesthetic gases, it's respiratory inhalers, and so on. And so the colleges have a really key role to play, you know, in engaging clinicians in this net zero journey. And so just to call out some of the things that have come up this evening, the first thing is about structures. It sounds like most colleges have set up special interest groups, networks, position statements, and so on. And those are actually really important, you know, to have the right people talking to each other and sharing ideas and leading things forward. So that's terrific to hear. Position statements are also useful to have it as a reference point, as a starting point. But if every college's task then is to decarbonise their specialty, you know, what are the important things that we've heard this evening? I think the first thing you're going to do if you need to decarbonise your specialty is to reduce low-value care. Okay? We stop doing the overdiagnosis and the overtreatment, which not only have harms and risks and costs for our patients, but also have financial costs and also have carbon costs. So it's really pleasing to hear colleges like ASIM and RACS looking at using the choosing wisely resources and thinking about reducing low value care. Really importantly, prescribing has come up a lot in the chat today. We know pharmaceuticals are 20% of our whole carbon footprint. And it was interesting to hear Nick say that the RACG, the College of General Practice in the UK, has been instrumental in pushing forward, you know, about the safer use and quality use of medicines, which of course also reduces the carbon footprint of medicines. Great to hear, you know, colleges like RANSCO who are looking at reducing waste. You know, cataract surgery is, I think, the most common procedure performed in the world. You know, so that's really, it's great to see RANSCO looking at what are the big carbon hotspots and how do we make a real difference there, and thinking about a different way to approach that. You know, if the UK and the US's cataract operations has 20 times the carbon footprint of that at Aravind, you know, what are the differences and how can we look at what they're doing? Technology, telehealth, and new models of care are really important. And of course, scaling up low carbon, very effective, low cost care, such as exercise. You know, exercise is medicine and a really important role for ACCEP in that instance. Very encouraging to hear about colleges who are embedding this in their training as well. And really interesting to see ANZCA looking at fellowships. So this has been a model that's been very effective in the UK, setting up clinical fellowships. So there's, you know, a registrar steps out of training for 0.5 or for 12 months and is involved in decarbonising their specialty and in sustainability projects for that. That's really, I think, a really terrific model. Great to hear that. The task for that, you know, for that team, of course, is to rethink and reimagine their specialty with a net zero lens. So it's bringing together, you know, research, training, and net zero into those sorts of roles. And then, of course, the collaboration is so important, and a shout out to the College of Physicians for their climate risk project and bringing together a whole, I think about 10 colleges together in that. A lot of comments about how can we work together. Nick didn't mention it, but he was, of course, instrumental in setting up the UK Health Alliance, which brought together, I think, about 20 colleges, including the College of Nursing and others as well in the UK. And they've been very vocal and quite effective. Of course, you know, some of the comments were saying, firstly, you can join DEA and you can join CAHA, Climate and Health Alliance as well. So those are good starting points. Then just finally, I just wanted to make a point about advocacy. We have, a lot of people have said tonight, doctors are the most trusted and respected professional group in society. We have a huge amount of influence. And on this call tonight, we have some of the most powerful medical voices in the country. And so it's a really clear role for colleges there to be very vocal on energy. We should be advocating for clean energy. We should have clean energy in all of our healthcare facilities. Air pollution is the new fossil fuel. Air pollution causes as many deaths globally every year as cigarette smoking. So there's no question that we should be having clean air in our health facilities, and that we should be advocating much more broadly for clean energy throughout the whole system. And again, as Nick mentioned, the RACGP and the College of GPs and of Physicians in the UK were very vocal and very public in clean air, and they've had tremendous success in pushing. If you look at Breathe London and the reduction in air pollution deaths and so on there. And the College of GPs, as I saw on the chat, is looking at posters in waiting rooms. I think that's a tremendous thing. Climate change is a health issue. This is what you can do. And with 44,000 GPs across the country, these are the sort of areas in which we can have real impact. So I'll finish up my comments there. I just have probably 2 questions. Unfortunately, Nick, there are a number of questions for Nick, but he couldn't stay on. But perhaps a question each for Omar and for John as well. And Omar, perhaps you won't be surprised by this question, but really the theme coming through is that on these sorts of calls tonight, we're preaching to the converted to some extent. The real challenge for us is how do we have your political will, and actually perhaps that's not so much political will, but that sort of huge public engagement. How do we engage our colleagues much more broadly, and how do we really step this up in terms of advocacy and action?
Yeah, thanks for that. I've got a couple of ideas. I think one is to actually demonstrate how some of this stuff can be done. So give individual doctors, practices, tools that they can use, ideas, suggestions on what they can do that are specific for their scope of practice. Whether you're in running a clinic or whether you're providing surgical procedures, there's going to be different things that you can do. Obviously, when it comes to the clinical decision making, that's a more deep issue that of course our colleges are already involved in. But there is more that can and must be done there, not just for environmental reasons, but actually to keep our health system ready for those who really need it as the demand increases. I think in the hospital sector, what I'd like to see is some demonstration hospitals. Someone should actually build a carbon neutral hospital and show that you can actually do it. And if we can get one state in Australia to do that, then straight away, I think we'll see that change ripple through the sector. And like any change, I think you need to get small wins. You need to show that this is not just another depressing, tidal wave, a tsunami coming that we can't do anything about. We actually do have actions that we can take, and to show those in action, to show that they work. Myself, I drive an electric car and I love it. I'm never going back to a petrol car, not just because of the climate impact, but because it's actually a better car to drive. And I think we'll find that as we make some of these changes, we'll say that it's not just a sustainability benefit, a climate benefit. There's actually clinical benefits. There's financial savings that will be really real. And the very last point, just on the hospital sector, we heard from the president-elect of the World Medical Association at a similar event the AMA ran at the national conference. And what they were doing in Sweden is actually employing people within their hospitals, a significant number of people whose job it is to drive sustainability. At the end of the day, we can't fit it into our everyday jobs. We need people whose job it is to do that. And if we can get, starting with one person employed in every major institution around the country, whose job is to look at sustainability, then I think we'll start to see that change speed up.
Yeah, terrific. Thanks so much. Just a couple of comments on that. I mean, we've got, the new Women's and Children's Hospital in Adelaide will be the first net zero all electric hospital in the country, which is great. And that's a good starting point. But actually, if you think, if you look at what Nick's talking about now, they're talking about a net zero hospital, and net zero in the sense that, I think something like 60% of them will be telehealth or technology consultations. Another 20% of those patients that they see will live very close to the hospital. So they're actually thinking, quite disruptively, like next level, what does actually a net zero hospital really look like when you take into account all those scope 3 emissions as well? And I completely agree with you on the point of resourcing. I mean, Nick's team is about 150 now, but they have about 1,500 across the country when you could look at the sustainability leads in each of the hospitals and the trusts and so on. So that's, you know, clearly where we need to get to. We're you know, 10 years behind the NHS on that. John, I'm actually going to hand over to you now because I know that you and Omar need time to quickly wrap up, but just sort of the comment that was coming through for you was that a lot of doctors know about this stuff, but they don't act. So I just wonder if you could, you know, in your wrapping up comments, respond to that, and I'll sign off and hand over to you. Thanks.
Lovely. Thanks very much, Kate. Thanks, summary as well from you, and many points in there. There are really lots of things that doctors can do. We can do our own personal thing, but we can also do it in our professional sense. And tonight we've heard of many of those things that we can do in a professional way. But I think that we also need to be cognizant of people within our own ranks who are still skeptic about what's going on. And it was great to hear from Mark tonight, who really highlighted that climate change is man-made, and that it's really up to us to reverse this. I think a recent survey that was done by KAHA, I noticed that the physicians who responded to that 20% of those were still dismissive about human-induced climate change. So that's 1 in 5 of the physicians who answered that survey. So I think that we need to be vocal and we need to be clear when people are talking about this, that this is our problem and that this is up to us to solve. And to that, you know, we've put this letter together now to the PM, and again with the AMA and 10 colleges, we've signed that, and that'll be going to the PM on Wednesday. We've got some media around that as well. So for everybody who will come across that article or see it on social media, etc., I mean, adding your voice to that and building the whole momentum behind what we're trying to do here is so important. We need to really knock out those people who are trying to hold back progress, because it's for us, it's for our families, it's for our patients, it's for our own existence. The AMA and DEA have put together the emission reduction targets, and it would be great if all the colleges could sign on to that as well. And we're advocating for 80% reduction in the healthcare sector emissions by 2030 and 0 by 2040. And this is roughly in line with really what we need to see in society as general. Hopefully after this is all over, that we'll get a summary of everybody's presentations and publish that in the MJA Insights, so that we've got a good summary of what's gone on, and that everyone can refer to that. And again, highlight to those who are not quite sure if this is all happening, that there's lots of people on board. I mean, that same survey from KAHA said that 50% of the physicians are also alarmed. So even though there's a smaller group who are dismissive, 50% are alarmed. So the majority of doctors are on board, and we've seen that tonight. And so finally, I'll also give a bit of a plug to DEA. I think, you know, we've been working in this space for 20 years. I think, you know, we're all part of our colleges, and it's great to see everybody doing things, but DEA has a unique position. And I think the more voices that we have within this organisation, the more that we can be proactive in the political and community sense as well. So thanks everyone for your involvement tonight as well.
And just finally, thank you, John, and thanks to all the other speakers this evening. It's certainly been a very informative chat. It's been great to hear of the individual activities of our many colleges, and of course to have such a lot of people online as well, listening in and contributing through the chat. And apologies we haven't been able to get to all those questions. It's a bit of a packed agenda with so many speakers. But just to add, I guess, final sum-ups from the AMA, I think we really do want to use our experience with COVID-19 to show that we can act fast, and we can act underpinned by science. There is no doubt now about the science. I think that message has been heard very, very clearly tonight. And it's not, the science isn't now talking about, is climate change real or is it man-made? we're now talking about how much time we've got left before it's too late to prevent so many of these huge impacts. So we do need to demand action, but we also need to lead by example, as we mentioned before, and do the things that are within our power and demonstrate leadership ourselves as individuals and as leaders within the community. Looking forward to seeing the impact our letter to the Prime Minister has tomorrow. That'll keep your eyes out open for it. There should be at least some media interest, and we just got to keep up this pressure as we lead up to the next to COP26, and of course all the future international fora where Australia is really being shown to be a laggard rather than a leader when it comes to climate change. So finally, as I said, thanks again to everybody, to our keynote speakers, our college representatives, and our moderators. We have really enjoyed running tonight's event. I would like to convene another one in 2022. Hopefully our COVID situation will be a little different, but I'm pretty sure we'll be online again in order to demonstrate the need to prevent our extraordinary carbon footprint of flying around our large country. But hopefully we'll be able to show the progress that's been made in the time since tonight's meeting and share some good news about a change in our political landscape when it comes to climate change. Thank you everybody very much, and good night.